Today we are very pleased to welcome special guests who will play roles in marking this new era in mental health care and this new beginning in care, recovery and rehabilitation. Gratitude is our refrain today, but so too is courage. The courage to be vulnerable and to find one's way back from a serious mental illness, to keep going, and then to speak about it and to give back. The courage to set a new course for the future and then stick to it no matter what the political climate. The courage to work through years of uncertainty and relocations. The courage to not only donate, but to speak openly about why businesses and communities must invest in mental health care. And the courage to say, this is my brother, my son, my mother, my friend, or to say this is me. And so as we rightly celebrate a new milestone, let's keep in mind there is much more to do, as our community has sadly witnessed this week. We need to go beyond let's talk to let's take action, particularly in affordable and supportive housing, if we are to truly embrace people experiencing mental illness and make a lasting difference.
This is a beautiful building, and this is a very respectful building. And for me, we are doing much, much more than opening a new building. We are celebrating a true transition. We are crossing a bridge. All of us are part of history today, because this building does represent far, far more than just a new building. It is a new way of caring for people.
I heard someone say that there was as much love poured into this building as there was cement. And like all great places, that is the thing that will keep it alive and keep it strong. It is the minds of people, not the backs, that do the heavy lifting for business today. We live in an economy which demands of 85% of all new jobs. It puts an emphasis on cerebral or brain skills. And by driving the symptoms of depression and schizophrenia and bipolar disorder in families, working and otherwise, further down, further back, faster and stronger and forever, we will have reached the state of curing, in chronic disorder terms, what is plaguing our planet as we speak.
13 years ago, our life changed. Our family started to notice our son withdraw from life as fears began to overwhelm him. We soon had a doctor tell us what he thought was happening. I remember the numbness that went through my body when I first heard the word psychosis. It was 2 weeks before I could say it out loud. 13 years ago, the word recovery was not used. In the early days, we floundered trying to find a goal to work towards. We labored under feelings of hopelessness. But change came as the global psychiatric community began using the word recovery. A new day had dawned, and we witnessed the signs of that change today. The mental health care building at Parkwood Institute is designed with the belief that recovery is possible, and just as importantly, that even people who do not achieve the level of hope for recovery are worthy of the best care possible. This new facility is aiming for excellence in care and research. Families look forward to what research reveals, but it is clear that there are some things St. Joseph's already has right. For anyone who has loved someone who has fallen ill knows that natural light, fresh air, privacy in a bedroom, a place to walk and a place to pray, a staff that believes in their patient and values family as a strong component of recovery has the best chance of reclaiming wellness. St. Joseph's commitment indeed to care for the body, mind, and spirit is evident here. And I am confident families will feel reassured that their loved one is safe and cared about.
The cry of those who suffer from mental illness has often been ignored. They were often shunned and marginalized, stigmatized in our community. This new Parkwood Institute will enable St. Joseph's to respond to their cry to hear those cries and respond to them, not by hiding them away, but in this beautiful facility and the specialized care that it can offer. It will enable us to provide healing, a healing environment, and enable patients to be restored in body and spirit, and to return to our community, to make their gifts available to all of us.
In partnership with teams and resources across our region, we will bring mental health care out of the shadows and into the light, embracing those who experience a mental illness and their families, and supporting those who are dedicated to excellent care, body, mind, and spirit.